This webinar is jointly organized with the Gender Equity Technical Group of ADB. Pandemic has disproportionately impacted women with wide-ranging effects on jobs, education, gender-based violence, and unpaid care work. We will hear more about this in a new policy brief we just released that Dr. Seon Park will present. COVID-19 crisis exposed women's vulnerabilities based on their pre-crisis social, economic, and political situations due to existing gender differences and social norms across regions and countries. Understanding gendered impact of COVID-19 pandemic can guide policymakers as they pursue gender-responsive policymaking and budgeting in the post-crisis recovery phase. Gender equality is one of the top priorities for ADB. Last year, ADB adopted its Strategy 2030 operational plan for gender equity, which outlined a clear vision of the importance of gender equality for both women's empowerment and effective means of achieving sustainable and inclusive development. Under this Strategy 2030, we also increased our corporate gender target. By 2030, 75% of all our operations will promote gender equality. From the earliest stages of COVID-19 outbreak, ADB responded to provide emergency support rapidly to our developing member countries, or DMC, through the COVID-19 pandemic response option. This is a new facility ADB established after COVID-19 outbreak called the CIPRO. This is a counter-cyclical expenditure support program providing a quick dispersing budget support to help governments finance their crisis-related social protection programs. By the end of 2020, there are 26 CIPROs expected to be committed for a total of 10.1 billion US dollars. Recognizing that women and girls in the poor and low-income families and households are among the most affected groups by the pandemic, all the CIPRO programs have included gender targets. For example, in social protection, our responses have included cash transfers and food subsidy targeted at the women and girls in vulnerable households. In Pakistan, for example, this has included supporting a Benazir Income Support Program, BISP, and BISP's expansion of its social protection measures targeting female-headed households. In the area of economic stimulus support, targets have been included to ensure women have equitable access to entrepreneurship development funds, rental support, or taxation moratoriums. ADB's emergency COVID-19 support also ensure the personal protective equipment and training to treat COVID-19 patients are provided to frontline health workers who are predominantly women. Our support has also directly addressed one of the pandemic's devastating consequences, which is the increased rate of gender-based violence. Emerging data have pointed to increases in domestic violence since the beginning of the pandemic, worsened by lockdown conditions, which has forced many victims to live with their abusers with little access to help. ADB has worked with its developing member countries' economies to provide resources for gender-based violence support programs. For example, in the Philippines, ADB will be supporting the Department of Health to conduct training for healthcare workers to identify, treat, and provide referrals to victims. This webinar is very timely as we start to look at recovery scenarios and strategies, especially in the context of gender equality. I'm pleased to introduce today's panelists on this webinar. These are Mr. Noah Rahman, the Director General Cash Transfers from the Benazir Income Support Program, BISP of Pakistan. Ms. Johnny Simpson, a Senior Specialist in Gender Equality and Non-Discrimination at the International Labour Organization, covering East Asia, Southeast Asia, and the Pacific. Ms. Shamshita Nanda, Technical Specialist, Social and Economic Development International Center for Research on Women, ICRW, and Ms. Sin-Young Park, Director of Economic Regional Cooperation Integration Division of ADB. So with that, I'd like to now invite Dr. Sin-Young Park to present her brief and summarizing our policy brief. So Sin-Young, floor is yours.
Thank you, Yasu, and thank you very much for participating in today's webinar. I would also like to express the sincere gratitude to the Gender Equity TG and the team's support, and also valuable comments on this policy brief that I'm presenting today. Can we have a slide, please? Mara? Okay. Next slide, please. Well, as we all have seen already, the pandemic has affected women's lives and livelihoods differently. The crisis threatens to reverse our hard-won gains in gender equality. It has caused both jobs and incomes to decline significantly more for women, given the existing vulnerabilities and the weaknesses in women's employment patterns. The lockdown and mobility restrictions related to containment efforts could also unduly burden women and girls. Mobility restrictions have been seen in girls' commute to school and the women's work, and those are being severely also constraining the mobility during the lockdown, and women are getting disproportionately large share of domestic responsibilities as well. Okay, next slide, please. We have seen quite a lot of progress already in women and gender equality, especially in education, health, child marriage, and adolescent childbearing in the past decade. However, based on the Gender Inequality Index, we still see a significant variation in gender equality across borders, and the gender gaps continue to persist. Some of the countries, like high income, especially the Republic of Korea, Singapore, and Japan, perform well in these dimensions. However, women continue to face a gender gap in employment, education, in also various progress in the workplace through glass ceiling in certain areas. In 2019 Human Development Report, it is emphasized that the social norms can perpetuate the gender gap across all issues, from gender-based violence to upward in politics and labor. Next slide, please. The gender gaps still are quite persistent in employment and also the wages. Labor force participation rates in Asia and the Pacific between men and women still quite different, and the male, as you can see in the chart that in the table, the male labor force participation rate is around 75%, compared to only slightly above 50% for female workers. The lowest labor force participation among women are found in South Asia at around 40%. The wage also shows a significant gender gap, and in the chart next to the table shows that the gender pay gaps for the 2017 or any latest year available. And you can see that there's still quite a substantial pay gap remains in between men and women. The pattern of employment is also suggesting that there are gender-based segmentation of jobs. Women in the formal employment by industry tend to be in a more low productivity, low paying traditional services with limited capital and skill accumulation potential. And women in Asia are particularly engaged in manufacturing and also the educational public administration services or wholesale retail trade. And then there are also a lot of health social workers. These are also heavily affected by the COVID, which exposed the vulnerability of women to this pandemic. Women are predominantly in also informal sectors where the social protections or any employment benefits are not provided. So the women's share in the informal employment is fairly high. This in a few Asian with few exceptions, in most Asian economies, women are disproportionately largely employed in the informal sector. And then these actually expose the women's the vulnerability during the crisis time. About on average, 7 out of 10 workers in Asia are the informal, and then women actually in the proportion exceeds the male in the informal employment. Women also spend more time on unpaid care work. This is data from OECD, and then on OECD average, it's women actually work more than twice than men in unpaid care work. And in Asia, in the examples like in here in India and China, that women spend disproportionately larger amount compared to OECD, and then also the working in the unpaid care work much more than men. Okay, next slide, please. The women's large engagement in care work also exposed them to infection during the COVID crisis. The lockdowns also hampered access to both healthcare and food, creating challenges for pregnant women and especially the mothers with young children who have a special needs for nutritious food, especially the micronutrient food. School closures also imply that about 370 million students do not have access to food normally provided at school. The lockdowns due to COVID prevented people from going also for their regular health checkup, general health, and then also personal care routines. And this actually creates also issue for the health conditions of people, and then especially the pregnant women or expectant mothers. The FPA suggested that disruption in access to family planning services due to COVID may affect an estimated 48 million women, which could result up to 7 million unintended pregnancies, and the impact on their health conditions. The next slide, please. In education, data also shows that the gender gap in the primary education enrollment and completion is quite disappearing already. But if we move on to the secondary education or higher, gender gap persists. In Asia, more girls are out of school at primary level, but more boys are out of school beyond primary schools. What's alarming is, though, in low-income economies, more females, more girls tend to be consistently out of school in all education level. So the girls, when they are poor, from the poor family, they tend to stay outside the schooling persistently throughout the entire education levels. And the education disruptions due to COVID-19 might have a long-lasting impact on girls. What we see is actually that the poverty really is tightly linked to the inequality for girls and then women, especially when the situation is bad, when the income declines substantially, women will likely be in a very dire situation, and that could have a more lasting impact beyond the crisis. So, next slide, please. Gender-based violence can increase during the crisis. The COVID caused massive unemployment. ILO now estimates about 900 million full-time job equivalent will be lost, and then this actually also come with a significant decline in income. This has resulted in increased alcohol and drug use in many countries, and some countries also report a deterioration in mental health. And these risk factors have led to higher emotional and physical violence in quite a few Asian economies that have reported, including Bangladesh. In India, for example, also the strictest lockdown rules had higher domestic violence and cybercrime compliance. The current situation also exposed the girls to increased domestic abusive activities, and then sometimes the sexual abuse, and girls aged 15 to 19 can be forced to have sex or facing unplanned, unwanted pregnancies, which will again keep the girls outside school even after the pandemic, which have a devastating impact on their future. So finally, can we have the next slide, please? The policy implication and what ADB has done and can do. The first, ADB, many countries have introduced the social protection and also the health insurance, even temporarily extended. So we need to enhance the social services and then health protection. And secondly, provide conditional and unconditional cash transfers and food assistance. And third, provide targeted support for most marginalized girls and boys. And fourth, create gender responsive education. I believe that we will discuss the more details and then country case studies in the panel. But the gender responsive educations are really needed as the gender gaps in education persist, and a lot of times we note that the stereotyping and then also having the role model will be essential and to create more gender neutral in education environment. And fifth, narrow gender gaps through skill development and job creation. Countries are now also providing more gender responsive skill development, job creation program for the employed during the pandemic. Helping them getting a job back when the economy recovers. And sixth, pursue gender responsive labor market policies. And then finally, address different forms of gender-based violence. I look forward to interesting discussion in the panel. Okay, over to you.
Thank you. Thank you very
Thank you very
much,
much,
Seong.
Seong.
Very
Very
nice,
nice,
succinct
succinct
summary of the report, and this highlighting impact of COVID-19 on women's jobs, incomes, education, health, nutrition, and unpaid care work. And also this policy brief provides a set of recommendations for gender responsive policies and sector specific strategies in response to the pandemic. So now let's move on to a panel discussion. So for the first round, I'd like to invite each of the panelists for initial intervention, 5 minutes intervention. So let me start from Mr. Noah Rahman Khan, Director General Cash Transfer BISP. I'd like to invite DG Khan for comments on the cash transfer program and the other aspects covered and also beyond this policy brief. Mr. Khan, floor is yours.
Thank you very much for giving me this opportunity to be one of the panelists on this very August webinar. And of course, I'm learning myself as well. The presentation given, this has been marvelous. And when I was going through the policy paper, even like the kind of situation which were depicted there, because of the COVID-19 and its impact on the poor and specifically on the women. Pakistan is not an exception to that, and we had all these impacts in our country as well. And just to give you a kind of importance of this policy document in the context of cause-powered poverty, where previously we estimated to have a poverty at 23%, and now it has gone up to 35.2%. So that actually necessitates more discussions and more interventions for the poor, and specifically for the vulnerable groups where women, they are at the top. Yes, as a response to the pandemic, we started here in Pakistan an ESAS emergency cash transfer program, which was actually an extension, a scale up of the National Social Protection System, which is this Benazir income support program. And we scale it up both vertically and horizontally from 4.6 million, we went up to 16.9 million household. And as you might be knowing that for us, the primary beneficiary or the recipient of the money is women. So more than 60% of the beneficiaries who received the emergency cash transfer, it was for women. And they, because we were cognizant of the fact that specifically the informal labor, majority of them, around 65% here in specifically in the rural areas, the informal workers, they are usually women, and it was having a direct impact on them. So initially, just as a quick response to the COVID, we we scaled up the social protection and included that majority of them. And we specifically, the Prime Minister of the country, he on his direction, a labor portal was developed, and then all the laborers who were affected by the COVID-19, they were requested to lodge a request on that, and then we processed them and we delivered the cash transfers to them as well. Now going forward, and because we know that since the poverty has increased, So the vulnerability has also increased. So what we did, we have actually, like for, as mentioned in the presentation, that there should be a gender responsive education system. So what we did, we have a conditional cash transfer for education, and just to encourage the girls to go to the school, we have increased their stipend, their monthly stipend, as compared to the boys. And then we also have immediately after the COVID-19 first wave, we have implemented on pilot basis a nutrition-based conditional cash transfer as well, where pregnant and lactating women, and their less than 2 years children, they are like they are provided conditional cash transfer if they meet certain conditionalities. Uh, and also regarding the social insurance, so we are discussing with the World Bank and other development partners. We are trying to find out a tailor-made social insurance program for the informal labor force of the country. We are designing that. We are in the designing phase, and we foresee that within this fiscal year we will also launch its pilot phase. And then for the financial inclusion of because the recipient of the cash transfer, they are necessarily women. So with Pakistan, we have launched a one woman one account initiative, which is for the financial inclusion. We are offering them saving accounts along with financial literacy training. So we also foresee that that will also bring about a very positive change in the life of these women. So this is all from my side. Thank you very much.
Thank you very much, DG Kang. Really important initiatives, wide range, conditional cash transfer, targeting for women, and also broader social protection programs, policies. That's really important to support the livelihood and the COVID-19 situation. Thank you very much for sharing. So now, second panelist, I'd like to invite Ms. Johnny Simpson from ILO, International Labour Organization. And probably I'd like to ask Ms. Simpson from the angle of female job losses, possibly drawing upon ILO's COVID monitor. And also, if possible, please give us some comments and feedbacks focusing on the unpaid care work. So again, 5 minutes, please.
Thank you so much. It's a pleasure to be here with you, and congratulations on this new brief. So first, most recent data from the ILO COVID monitor revealed a significant decline in employment in the second quarter compared with previous year, though with considerable variation across countries. And the ADB brief mentions that women face higher risks of losing jobs or income, and we certainly concur. The relative decline in employment is greater for women than for men in all countries. That was a finding. So this is highlighting the gendered impacts of the crisis at play, and these were well elaborated in the brief. Another trend that seems to be at play is that across many countries, at least from what we can see, let's say not enough emphasis on gendered impacts of addressing these issues in the response packages to COVID-19, addressing women's strategic needs. There's clearly at this time an opportunity to rethink and build back a better future by moving towards closing some of these persistent inequalities, including gender inequalities. And the economic downturn is different from previous crises, as sectors overexposed to the collapse in economic activity are highly feminized, as was pointed out, and the four sectors raised are the same ones that we find. And in low income countries and lower middle income countries, there is a risk that many of the manufacturing jobs, and in particular the garment industry, which really absorbs a large number of women, particularly in the low-skilled jobs, will disappear, while the absence of stronger systems of social protection jeopardize the health and incomes of these workers, as well as the viability of the businesses. What your brief outlines and what we also find at the ILO is that COVID-19 has exacerbated pre-existing inequalities, and it's not surprising then that many women, but not all, were at a disadvantage before going into COVID-19, and now they are feeling the crisis even more because of the precariousness of their position in the labor force. Now, COVID pandemic has posed other challenges for women who, as was mentioned, comprise 88% of healthcare workers and who are on the front line, while managerial jobs tend to be held by men. So while in this case, these aren't job losses, but however, we do see and are hearing anecdotal evidence of violence and harassment occurring as well with regards to, in particular, healthcare workers. I'd like to mention another aspect, perhaps one that wasn't raised so much in the brief, but that is the plight of women migrant workers. Many migrant domestic workers are in the region who are providing essential care, both paid and unpaid, to families and elderly persons. Many of them went into lockdown with their employees and were unable to return to their families in their countries of origin. Now, on the unpaid care aspect, and prior to COVID-19, it must be said that this we found with the evidence that was the top barrier to women's full participation in the labor market in this region. COVID-19, of course, as you rightly point out, has further exacerbated women's unpaid care duties. And prior to COVID-19, 49.5% of women of working age declared they were either unavailable for employment or not seeking a job due to this unpaid care burden. And other efforts that we've done, for example, a report with Gallup showed that the vast majority of women and men wanted women to work outside of the home in paid jobs, but this unpaid care is one of the main and the top constraint. So this, of course, adversely affects women's employment prospects, and we need to shift somehow into sharing this. And different from what the brief says, our findings were that in this region, women do on average 4 times as much unpaid care work than men, and that men in this region do the least unpaid care work on average, of course, of all regions. So COVID has certainly highlighted how important unpaid care is, and it will remain to be seen whether this burden and the invisibility of the previous issue, that COVID may highlight this enough that this will be addressed with policies, programs, and investments to support workers and employers, in particular women, to get in and remain in the workforce. And we've put out a resource during COVID time that we did with UNICEF and UN Women on specific things that employers can do to support workers with family responsibilities during COVID, because this is going to affect women's ability in particular to get back to work. And so we'll need to be sensitive to this for a time so that we're not penalizing women even further. I'll stop here for now and hand back to you. Thank you.
Thank you very much, Ms. Simpson. Thank you for sharing a very granular data, information, and evidence based on ILO's monitoring. And also, I thought in general, pandemic or disaster seems to strengthen the pre-disaster situation. I think this time is not the exception. So many gender-related issues and gender gaps seems to be really widened because of the pandemic, outbreak of a pandemic. And also another issue, challenges faced by migrant domestic workers ADB is sitting in Metro Manila, the Philippines. So this is quite relevant issues for the migrant workers, overseas Filipino migrant workers. Thank you very much. So let's invite Ms. Shamishta Nanda. She is from International Center for Research on Women, ECRW. And specifically, I'd like to ask Ms. Nanda about data gap issues on measuring COVID-19 impacts on women. Ms. Nanda, can you join on 5 minutes?
Yes,
Please, floor is
thank
yours.
you
Thank
so
you.
much. I think the presentation on the brief was great, and also the reflections by my fellow panelists are very much in line with the question that you've requested me to reflect on. So in terms of measurement and in terms of the need for a restructuring of gender responsive policy responses, especially in the context of COVID, I would like to draw upon the work that ICRW is doing currently with Global Health 50/50 and APHRC in Africa on building the sex disaggregated data tracker. What we intend to do is look at how countries are reporting along different parameters related to COVID-19 on based on sex and gender. And we find that among the countries, the top 10 countries which have, in terms of the number of confirmed COVID-19 cases, only 4 are reporting data that is sex disaggregated. And even within that, we don't see any integration of gender concerns into the reporting. So we don't, for instance, have any data on the number of transgender and non-binary people reflected in the global data sets. And this also leads us to point at major blind spots in terms of our understanding of how the pandemic is impacting men and women differently, apart from the biological differences that are captured in the clinical reporting. So a lot of issues around social environments, structures, normative barriers, gender role expectations, in terms of spatial differences on where men and women spend most of their times, the kind of jobs they are assigned in terms of their gender roles to be performing on a day-to-day basis. We don't see that kind of considerations being reflected in the data that we are being able to capture globally. And it's more relevant in the context of what the previous panelists have been talking about in terms of issues such as what are the social security measures in place? What kind of policy responses have we seen in the last 6 to 8 months? What are these responses really based on? If we are not collecting data that talks about how men, women, and people of other genders are being affected differently by the pandemic, we won't really be able to implement policies that take care of the contextual differences and needs of all the genders, in a comprehensive manner. Another point that is important for us to look at in the rebuilding process is also that as the number of cases globally seems to be reaching a point of slowing down of the pandemic, a lot of countries that were previously reporting on sex disaggregated data are no longer doing that. So we see a cumulative reporting on the number of confirmed cases and the number of cases which have recovered, but the differential reporting seems to be going down. So what does that mean for us? What does this mean for researchers and practitioners who have been advocating for more gender responsive and more gender integrated policies in terms of building back? So these are some questions rather than answers that I would like to leave the discussion with. And I would also like permission from the moderator to share a link for this particular piece of work in the chat box. Thank you.
Yes, thank you. Thank you very much, Ms. Nanda, for pointing out, this is really indispensable or necessary precondition of having sex disaggregated data. And for your information, there is an initiative, many people are aware, but there is a UN Statistics Division and UN Women project, EDGE project, Evidence and Data for Gender Equality. So ADB has been supporting this EDGE project to collect systematically sex disaggregated data so that we can do a more focused, more effective policy for gender equality. And also thank you very much for sharing link, Ms. Nanda. So please put the link in the chat box. Thank you. Thank you very much. So having three very nice, excellent responses by three panelists on our policy brief, I'd like to move on to the more moderated, more interactive panel. And in the meantime, panel discussion. In the meantime, please put your questions for participants. If you have questions, please type in chat box so that we can have interaction later on. So first round of a panel discussion, I'd like to talk about C session globally, which is more women losing their jobs than men because of COVID-19. And this is because women represent the majority of works that most hard hit by COVID-19. And in a region where female labor force participation on average is declining even before pre-COVID-19, what are the implications for the Asian Pacific? What is the likely scenario for post-COVID-19 scenario will be the new normal, which can provide the opportunity to increase female labor force participation and revert the pre-COVID-19 trend of declining female labor force participation. So I'd like to invite three panelists and also Seon Park. First, I'd like to ask Johnny to discuss the data on garment workers in Bangladesh and also other ILO data looking at automation impacts. And as we all know, Bangladesh, we may call it the Bangladesh miracle happening. We are observing in the last 2 decades or so. And garment industry, ready-made garment industry production export became a really leading sector of Bangladesh, really a high growth rate in last at least 1 decade. And women workers are really core of this garment sector. Having said this, we also observed Rana Plaza collapse about 10 years ago, and labor safeguard and the social safeguard we should really place very higher weights. But having said this, I think garment workers really play a key role. And so please kindly discuss, maybe in the context of Bangladesh or other based on ILO data. So Johnny, please, floor is yours.
Thanks so much. Yes, indeed, the garment sector is certainly a key sector for women's employment in some countries. I can think of Cambodia. I think it's 1 in 5 households rely on a garment sector for their livelihoods. So it's extremely important. Another aspect of that is that millions of women got their first formal jobs not all are formal, but in the garment sector, a lot of women came into the formal economy for the first time, were able to access maternity protection for the first time because they were formal. So this is certainly a very important sector, a sector that still faces a lot of challenges in terms of, as you mentioned, pay, but that has been improved improving gradually after such crisis as the Rana Plaza. There was a lot of rethink. So manufacturing, especially in the garment sector in lower and middle income countries, is among those top 4 sectors deemed high risk of job losses and disruptions due to COVID-19. And in the beginning, we saw cancellations of buyers' orders. This was common. Manufacturers were also experiencing disruptions in their supply inputs. And then the typical worker, mainly women, lost out on at least 2 or 4 weeks of work, with only 3 in 5 workers being called back to the factory. And those still employed in the second quarter of this year also reported declines in earnings and delay in wages and payments because of the company's precariousness as well. Women are also harder hit in this industry because they are in the lower skilled, lower paid, and more precarious jobs and tasks. Many of these jobs may well never return due to closures of many factories, but also due to the move to increased automation of these lower skilled jobs in the sector, which we know is going to hit women disproportionately due to the skill gaps and due to what is mentioned before is occupational segregation. Women in the garment sector often say that they do not see a career path. They come in at the lower end and it's harder to move up. ILO has been working through its Better Work ILO IFC program to get more women into supervisory positions, and that has made positive impacts on productivity on those lines. But we're still seeing that women are mainly concentrated in those jobs. So the share of employment within the garment sector for women may decrease. And our research finds that one of the largest drivers of defeminization is this technological upgrading. And it may be accelerated by COVID-19. And as some of the more professionalized factories aim to upgrade. And so women are mainly in the operator positions or at the sewer positions and likely to be replaced. And combined with that loss of jobs, we're going to see women coming, unfortunately, out of the labor force altogether. So the main message here is that we need gender responsive policy responses. We need to see this investment in upskilling, looking to see how we can support these low-skilled workers, many of them informal, to get back to the labor market. Otherwise, the gains that were made on gender equality and having women in the labor market risk to be lost. And we're expecting an increase in informality due to COVID in the garment sector, which means decreased job quality. So it also raises the question of where these workers will go. And as workers with low-skilled jobs, we really do need to remember that women are concentrated due to the stereotypes and norms that were mentioned in the brief. They do get concentrated in a very small number of jobs and opportunities. So we need to address this, make sure that women are able to access more jobs and, equity in terms of the jobs that they can get into, while addressing their direct and indirect discrimination that is impacting them in the world of work. And remembering that the unpaid care duties will likely hamper their return. But if I come to the positive side in terms of what's being done in the garment sector, governments are responding to the crisis by supporting workers and enterprises along various dimensions, but it still remains to be seen whether the support is sufficient. There was a global call to action that was launched as an industry-wide effort to support factories and workers during this crisis. it's clear that there is a need to work together and with social dialogue to solve these problems, but also bring in more diversity into that problem solving. And I go back to the issue of women's voice representation and leadership, which is lacking in across the board. But you would think in a highly feminized sector, we could come to some better solutions in terms of their involvement at the policy and decision making. Thank you.
Thank you very much, Johnny. So as you highlighted, technology, displacement, unemployment, and also COVID-19 driven unemployment. I think these really adversely affecting women. And then on top of that, even pre-COVID-19 situation, how to climbing up the ladder of social development. That has been really an issue for government workers in Bangladesh and other female and women workers in the region. So I think this is very, very important in manufacturing sector and service sector. But at the same time, I think we need to put the care on rural areas. What's the scope for providing better opportunities for increasing female labor force participation. So now I'd like to invite Shamishta to discuss women's livelihood in the context of rural areas and low-income areas. So Shamishta, would you like to respond?
Yes, thank you so much. And I think Joni's presentation has set the context for me very well. In terms of rural areas or low resource settings, which could also include some of the urban areas in countries like India, a lot of work that we are involved in talks about the need to use a more comprehensive lens to work with women and girls. And by comprehensive, I mean whenever we are designing an intervention or research or conducting a policy analysis exercise, we look at the ecosystem of where these women and girls are located. So that means not just acknowledging and addressing individual needs, but also their interactions with the surrounding environment, which includes state supported structures and systems, which includes communities and the norms these communities may be imposing on them, and ultimately their immediate families and important stakeholders in all of these different layers of interactions in the girls and women's lives. So if we want to talk about livelihood opportunities or how do women and girls from these contexts end up in the labor force, or they don't end up in the labor force, what are some of the factors around their trajectory of entering a livelihood? We do see a huge need to talk about a spectrum of issues. So as researchers and programmers, we may be going in with a thematic segregation on addressing a single component such as skilling or their access to education or preventing early marriages. But in the event of an individual's lives, a lot of these issues are very, very interconnected. So how do we ensure that the policy responses in building back and in enhancing women's labor force participation also looks at a more comprehensive approach is one of the central questions that we are dealing with at this time. And our inclination has strengthened over the period of the last few years, and more so in the COVID context, that we need to not just collect data that we talked about earlier, but also hear from these women and girls themselves and understand what are the different barriers in the various domains within their life that ultimately decides whether they will end up in formal employment or informal employment, what kind of skilling and education they'll access, at what point they will enter the workforce, like my fellow panelist was explaining about the garment sector. So one of the studies that we just wrapped up was addressing the question of traditional and non-traditional livelihoods for women in India. And that aligns to the question raised in the policy brief on stereotypical and non-stereotypical jobs for women. And what we heard from a number of our respondents was looking at the nexus between the state supported policies, the market dynamics, and the gender role expectations from women and girls in these contexts within the household. So not one, but all of these three different domains actually decide where women are going to end up. And this is more true in the context of COVID, because a lot more is not within the domain of control for individuals or for communities as well. A lot is dictated and a lot is controlled by the state. And of course, the market, which includes both the public and the private sectors. So my key message to this would be to, as a community, advocate for cross-sectoral and integrated policy focus in trying to build back for a more robust labor force participation for women. Thank you.
Yeah, thank you. Thank you very much. Now, I think we also need to, it has been obvious that we need to put more care on quality side, not only quantity or just merely participation, but the job quality for women. And as I mentioned, C-session, more women are losing their jobs than men. C-session seems to be getting a keyword for post-COVID or COVID response and the post-COVID recovery. So now I'd like to invite the CEO to discuss the negative impact of recession or C-session on job quality for women. CEO, please unmute your microphone.
Sorry. Thank you, Yasu, and thank you very much for all the panelists, the valuable comments and then feedback. In fact, I think the COVID-19, the impact has been really gender different, and also it's due to the in some part, the nature of the crisis being more health and health crisis as an origin compared to the past sort of Asian and financial, Asian and global and financial crisis, which affected more male-dominated industries. But it also highlights the pre-existing inequalities in women's employment and the quality of the jobs that women tend to be in. In fact, those are exacerbating the impact of the COVID, both in terms of also its a social impact as well as economic impact. The women still are very much in the low productivity, more traditional services, and also very labor intensive in the manufacturing sector, as Johnny mentioned. And those sectors were hit hard by the COVID. This time, a lot of these labor intensive manufacturing industries had suffered a decline in exports and also had to close the factories, which forced many women to lose jobs. And women tend to be also highly represented in the informal sector, which makes them, when they are when they are out of job, not really being protected by the social security or the labor protection or any other even health insurance. So this, the absence of various social protections related to jobs were not really granted to many jobs. The women tend to be overrepresented. Also, we have seen this has been a perennial issue that in the women or women tend to be less employed, and then they actually also are getting paid less in their employment. So all those show up in a hard sort of a situation the women is experiencing during the pandemic. So what can actually the policymakers do, in fact, for preparing for post-pandemic? In fact, the prolonged employment may create a bigger hardship for women. We need to also note the recent sort of a trend of uptaking digitalization and then really rapid digital transformation in many economies during the COVID. They are moving to non-contact sort of technologies, and they may even exacerbate the women who are falling behind, and then showing the digital gaps in the access and then also use of these digital technologies. As some of the governments have already initiated, in terms of the government policy support, they do need to provide some education and reskilling support for women, prepare them for return to jobs, and probably also in the post-COVID with higher digital use, they can return with better digital skills and have a bit more potential to move up in their employment for better opportunity and then better income. So we do need to look at the current barriers to this women's employment, and then also the improving the quality of a women's employment, and how the government can actually support those women returning to the labor market after the crisis by providing really strong support on the education and skill training, especially in terms of the digital technology and digital skills. Thanks.
Thank you very much, Sin-Young. Now we are also interested in situation of each different countries. So I'd like to invite Noah Rahman to discuss female job trend in Pakistan. We have seen C-sections and also challenge of providing opportunities to increase female labor force participation. We'd like to know more about the situation about Pakistan in a female job trend. Would you like to come in?
Okay, thank you very much. Yes, I would like to comment. As I mentioned while I was responding earlier, that like more than 60% of the labor force here in Pakistan, specifically in rural areas, they are women. So obviously, since the government is also working on devising a policy where they can, as mentioned a bit earlier by one of the panelists, that digitization specifically in the job sector. So the government is focusing on that to introduce new technology to new learnings, specifically to the women at the school level and at the college level. And once the pandemic is over, and obviously this pandemic is changing the dynamics of everywhere. So we also foresee that here in Pakistan, that the dynamics of jobs after once the pandemic is over would be different from what we had previously. So that was from the government side. They are working on policies, and in the context of what we are doing here at the social protection side, or this organization, as you know, ADB is helping us for piloting some graduation programs, which are like giving microfinancing to women entrepreneur, and also to work on their skill development and to help them earn better livelihood. So obviously they are directed towards women as well. The focus is on women. So we are expediting that. One of our sister organization, which is Pakistan Poverty Alleviation Fund, they would be implementing that, and they would be using a database of the National Socioeconomic Registry, which is managed by Benazir Income Support Program. So the focus is on women, and as I mentioned earlier, that we are also working on encouraging women, and specifically in the informal sector, that they should contribute in the social insurance program that we are planning to launch for them, which obviously is in the designing phase, and we foresee that within this fiscal year at least a pilot should be out. So everywhere the focus is on how to skill the women which are more vulnerable, to be skilled them better and to equip them for the challenges, the dynamic changes in the job sector, so that once the recession is over and the jobs are coming up, they should be ready to have the emerging skill sets. So that's all from my side. Thank you.
Thank you. Thank you very much. A very nice insight. And now a little bit switching gear, but I would like to discuss issues around unpaid care work, as Johnny already kindly discussed. So in order to address women's unpaid care work and also to enhance social protection, actually, these things became really under spotlight during the pandemic. So my question I'd like to ask to Johnny and Noor Rahman again is, what are some of the policy trends that you have seen globally in the region, and how government can invest in a care economy? Especially to Johnny, we observe universal social protection policies getting very popular, universal basic income, for example. And on the other day, I was commenting on Nobel Economics Prize winner, Professor Abhijit Banerjee of MIT. Before I was a bit skeptical about the feasibility of UBI as a hard-boiled economist, but actually Professor Banerjee has been saying that there are rigorous evidence accumulated effectiveness of UBI, and especially in a low-income context. And even he said ultra UBI program quite useful. So Johnny, I'd like to invite you for discussion about universal social protection policies and importance of public and private sectors.
Thanks so much. Well, and we can certainly see in the times of COVID-19 that social protection is really a line of defense for society and acts as a stabilizer. And of course, on the gendered front, has already been said, because women are in the lower skilled and also a lot in the informal economy, well, their line of defense is really not that strong. It seems that about half of the region's population has no social protection coverage. So at this time, actually, the ILO, I'm not involved in social protection, but we have colleagues who are out there, as other organizations are, supporting countries to get relief packages out to respond to COVID, but only a handful of countries have comprehensive social protection systems with a broader coverage, and the most poverty targeted schemes fail to reach the poorest families still. Maternity, unemployment, sickness, disability benefits, mostly covered by contributory schemes, remain the preserve of workers with a formal job, and then not so much. So women with care responsibilities, if I can go back to the unpaid care, are also more likely to be self-employed or contributing family workers or in the informal economy, so less likely to contribute to Social Security than other women and men. Therefore, in times of crisis, their safety nets are more likely to be insufficient. And this is why targeted measures with the leave no one behind aspect are required. There's also a need to recognize the need for adequate social protection to women throughout their life cycles. Social protection design matters for gender equality. Mechanisms to recognize and reward care and unpaid care work are necessary. For example, pension formulas could place a higher weighting on the first years of contribution to support workers with frequent interruptions, which is often the case with women. And public or subsidized childcare services should be significantly improved in many countries in Asia Pacific to allow women's confident participation in the labor force. And there is a need to expand social protection to informal workers, where, as we know, women are highly concentrated. What can I say here? So almost 2/3 of the world's children had no social protection coverage. Only 22% of unemployed persons received unemployment cash benefits, and just 28% of persons with severe disabilities received disability cash benefits. This is from one of the ILO social protection reports. So these care infrastructures, extremely important, affordable, accessible, and professional care services. And I'd like to point out sort of the spectrum, because at the early child care level, women pay a leadership penalty, an employment penalty, and a pay penalty for the 0 to 6-year-old children care duties. So focusing on that end, and when women are again pulled out at the other end of the spectrum for elder care, we need to be looking at these care services. And in terms of the building back better, and in light of these challenges faced by families and in particular women, we could be looking at this as an opportunity. Investing in care services and care infrastructure could make a significant advancement for gender equality, but at the same time, knowing that we would be building strong care infrastructures, we have seen that this has the potential to generate an additional 72 million jobs in the care sector. And then you can think of the expansion effect of the indirect jobs that could also generate. And that could be as well increasing the quality of that work. And the demand for care work is likely to grow in future years when we look at aging populations. So the increase number, if we look at accounting for people in need of care and support recovering from COVID-19, we'll need to have a look, and we can take a look to see the build back better aspect of the health sector, but also including care services. And if I could, I'd like to raise one issue that has been raised in terms of domestic violence, but also in terms of the world of work. I would like to raise the fact that the work from home modality of COVID has pushed so many workers online. And we know that from our research and looking at online work, platform economy and such, that of course this is a very important means of work, but at the same time we're seeing cyberbullying and online harassment happening. So I'd like to flag the importance of addressing violence and harassment in the world of work, and I'd also like to flag the new convention, ILO Convention number 190, the Violence and Harassment Convention, and its recommendation that were adopted by government workers and employers last year at the International Labour Conference. And COVID has actually further reinforced the importance of addressing this issue from home to work. There is a place for World of Work organizations to address this issue, and it's a very important element of the Building Back Better. And I've asked to share some links in the chat, so if you see those there's some on the violence effort. Thank you so much.
Thank you very much, Johnny. And I think issues around work from home modality and what's the consequences on gender, and especially gender violence. In that respect, I'd like to briefly mention, together with ADB's ICC's Gender Equity Thematic Group, we are joining a rolling out of rapid assessment survey on gender impact of COVID-19 Asia and Pacific. And this is, I believe, this kind of data collection effort to accumulate evidence is really indispensable precondition for very effective policy measures. So I'd like to invite Noah Rahman for this unpaid care work and care economy issues. And we are aware BISP has been really carefully designed and expanded, and even including social protection measures targeting a female-headed household. So I'd like to invite Noah Rahman to elaborate on some aspects of BISP, how BISP has responded to COVID-19 impact on women. Noah Rahman.
Okay, thank you.
Yep.
Thank you very much. As I mentioned, the program, it was scaled up from 4.6 million to 16.9 million, and there was a specific category for the unpaid laborers at that time, like the laborers who were affected by the COVID-19. So we also included that, and that included the unpaid care workers as well. And we just like other categories, we also extended them the cash transfers, and they are still on the payment list of BISP. So we have responded to them, although they have lost their jobs at that time, but just to ensure that they have the food security, we extended to them the cash transfers. And now, because at that time the data set that we had, that was almost 7 years old. Now we are updating our national socio-economic registry as well, and we are collecting information on their jobs and their employment as well. So once we will have the updated data with us, then it will be very easier for us that in case of shocks, we can easily extend cash transfer to them. And obviously, as I mentioned, that we are also working on their graduation as to how to improve their skill set, and we are also working on that. I hope I answered your question.
Yes, thank you very much. Now, last question from me. I'd like to postulate, but before that, if a participant, if you have some questions, please type in chat box so that we can respond and panelists can interact over your question. So the final question is about education as well as skill of women. According to our data and also many reports and studies showing that Asian Pacific region has successfully narrowed, if not reversed, gender gaps in primary education, secondary education, enrollment rates over the past few decades. But also evidence suggests gender segregation in jobs persists, while gender stereotyping often starts at home and entrenched throughout the school education. Now, COVID-19 situation, virtual classroom seems to also accelerate digital transformation, but at the same time, a digital divide in gender dimension. So I'd like to ask what kind of new normal we need to envision, and what's the implication for education skills in the region. So now I'd like to invite Shamishta. So early evidence from India showing attrition of girls with a low transition from primary to secondary and increases in early marriage after outbreak of COVID-19. So would you like to discuss some implication for education and also social or labor participation during the COVID-19 pandemic?
Thank you. So yes, you're right. We are seeing a lot of attrition from the primary to secondary transition. Also increases in early marriage, and as you also noted, pre-existing data also talked about the fact that although our enrollment rates have increased over the past few decades, it doesn't translate into labor force participation for women. So again, going back to one of the recent studies that we did, a lot of reasons for why girls tend to drop out at a certain point in their educational journey, or why they tend to drop out of workforce participation, at what point in their lives does that happen, points to a range of gender role expectations that they have to negotiate with on a daily basis. And it has a lot to do with girls attaining puberty. And with that, a lot of strong familial expectations and concerns tied around their, protecting them from a range of things, such as getting teased on their way to school or work, protecting any kind of, sexual or sexual abuse incidences of violence and harassment that tend to increase around that time for women and girls, especially in contexts like India. So there is a sea of literature that talks about these issues and how they are very closely tied to, what kind of demographic profiles do we see in terms of dropouts from education, dropouts from skilling, and also dropouts from the labor force. Now, in the context of COVID, all of these normative, barriers seem to be enhanced manyfold, as we have also seen in other crisis contexts, such as, in the Indian context, we could look back at the tsunami data, or the Gujarat earthquake and what happened after that. And more recently, if we look at a pandemic context, we can look at literature from the Ebola crisis in Africa. And the COVID-related unfolding of events also points to similar things in terms of getting girls married early, families not, excuse me, willing to invest further in their education because their resources and the economic crisis for the family itself is difficult to manage in this scenario. So the first things to be let go of are to stop the girl's education and get her married, so that the family doesn't have to bear her expenses for a prolonged amount of time. Now, this has major repercussions for how the labor force participation could look like in the next few years, because a lot of these dropouts and a lot of these marriages and important transitions are happening with girls who are in their adolescence or who are in the early stages of their higher education. And if they are dropping out now, it means that their likelihood of entering formal workforce is going to further decrease. One important thing that has happened in India in this context recently is that we have launched a time use survey, which will give us more robust estimates on how different genders spend their time and what kind of activities. And this links back to the unpaid care work discussion that we were having in relation to the earlier question. So, I'm talking about this because this links very directly to the gender role expectations that play a major role in why girls need to drop out of education and skilling, and why do they need to get married early. If in our policy response, we could advocate for integrating some of these concerns with a more evidence-based approach, a lot of issues around what we are seeing in the new normal or what we are not seeing in the new normal but is desirable could be taken care of. This also has important repercussions for the digital transformation that we are talking about. Unfortunately, at this time, during the pandemic and extended school closures, we saw very, very glaring pictures of India's digital divide that not just enhanced the differences between who could access digital education and who couldn't, but within that, there were glaring gaps between boys and girls. Because like in India, it's well established that access to digital spaces and devices is much more limited for girls than for their brothers or men within their families. So these are a few points that I wanted to highlight in this respect. Thank you.
Thank you very much, Shamish. Very, very important insight. And I remember after 2004 tsunami disaster, there was a phenomenon called the tsunami marriage in Nagapattinam district in Tamil Nadu state. So I think, especially during the crisis of any sort, I think really policy should support education, continuation of education, also labor participation, also broader social protection of women, providing a different type of support of families. So I think this is very important. But at the same time, personally, I visit one low-income community in Metro Manila over the weekend, Saturday afternoon. And we are especially supporting children who are out of school because of school closure. And so we are providing tutoring, private tutoring program. And then I saw a majority always tutoring program, more than half or probably 80% of attendees of children are women. So I really see a big potential of women's empowerment in education and also labor and social development. So now I'd like to invite Sin-Young to talk about again, quality side of education, especially female education in STEM track. Yeah.
Okay, thank you, Yasu. Well, as we are now keenly aware that we do need to prepare women for the type of jobs and also adjusting to the changing nature of work post-COVID and beyond. This really is about digital transformation and the need to narrow the gender gap in digital, in literacy, and then also digital skills. Somehow still, like, even after we made so much progress in narrowing the gap in the school enrollment and also completion between men and women, now women still fall quite behind men in terms of STEM education, especially in a higher education level. And there are only 35% of women involved in the STEM in higher education level around the world. And this really reflects the entrenched social inequality, the gender norm, also stereotyping of jobs and work, as well as the absence of role models for girls. And that's the reason why the promoting the STEM education for girls is not just about the somehow reform of the education modality, or trying to get the girls and boys to stay school longer, or attending more rigorously. It really should be about changing the gender norms and bring more balanced approach to correcting the stereotyping and also gender-based sort of segregation of the work, and in increasing more women and then leaders in science and technology, so that the girls can learn. They can also do many social and even medical science. Find the evidence that there's no difference actually between girls and boys in terms of their ability or capacity to take these STEM courses. But somehow, girls tend to choose not more social science, or just the literature rather than the STEM courses, and that's the reason why many scientists believe that this is really due to the cultural, or it's really reflecting the entrenched social norms, and then especially about the women should do certain things and the men should certain things, and this is it's requiring a fundamental a rethinking when we try to promote the STEM education for girls. This has to really take the countries, maybe not even the village will be able to address this problem. So for girls, this is really the key issue, to take up more STEM education, and then being ready for future work when they grow up. Thank you.
Thank you. Thank you very much. Due to some technical issues, I couldn't see comments on or questions in chat box, but now we have a couple of comments. First one is gender disaggregated statistics. Issue is to support countries in getting quality statistics. Yes, this is very important. Indeed, IDB has been working and supporting statistical agency in our developing member countries' economies in strengthening, collecting and compiling quality statistics. So I think this is very important. Important to recap this point. And one question, finally, although we need to close, each panelist, please respond in 1 minute. Another question is, what more can be do to build back better in a more equitable and inclusive way? So probably one word, each panelist, what we should do. What's the top priority for building back better, for equitable and inclusive for women, recovery from COVID-19? So I'd like to invite Johnny. Would you like to say maybe 30 seconds?
Okay, thanks. It won't be one word for sure. Okay, priorities would be universal collectivized social protection and healthcare, including access to maternity and paternity protection measures, women's voice representation and leadership alongside men on all levels, including in social dialogue, to get better solutions going for all of the complex issues in the world of work these days. Applying relevant labor standards. Someone in the chat was asking about what to do. We can increase women's capacities, but we need to take care of the structural barriers, and that would include various international labor standards, but I'd like to point out Convention 190 because it's such an important issue. Addressing unpaid care burdens, investing in the care economy, and valuing women's work, which is highly undervalued. And last would be upskilling and removing discrimination in all jobs and sectors, and including in women's entrepreneurship development. Thank you.
Thank you very much. Noah Raman, would you like to say respond to this question about how to do better building back better?
Yeah, the answer to this is we need to have a well-integrated social protection system which is shock responsive, and it should take care of all the families who are vulnerable, and specifically the women. And we should be working on their skill development and to better equip them, that in case if there is another shock when the economies are closed, so obviously they can be reached out to and they can be helped. Thank you.
Thank you very much, Raman. Shamishta, so what is your final word?
Thank you. My internet has been acting up a little bit. I just wanted to respond to this particular question and generally
Okay.
just to say that, yeah, we need to demand greater state accountability in terms of policy making, and not just for COVID-19, responding to COVID-19, but for a more inclusive post-COVID-19 world. And also want to stress a little bit on stronger civil society representation and involvement in developing as well as implementation of policies. So yeah, I'll leave with that.
Yeah, thank you very much. Seon?
Thank you. Well, I would like to actually emphasize that we need to protect the girls and their future. The sharp decline in household income threatens the girls to be out of school and stay out of school longer. It will actually hurt their future. And going to school, we also continue to encourage them and nurture their interest in STEM-related subjects so that they can be prepared for a more digital future. Thank you.
Thank you very much, all the panelists. We had a very, very good and lively discussion on COVID-19 impact on gender equality. As I mentioned in our research department, gender equality has been one of the top priority strategic research area. And as I mentioned, rapid assessment survey on the gender impacts of COVID-19, Asia and Pacific, we are closely working with the SDCC, Gender Equity Thematic Group. And also, this is a collaborative work of UN Women. Women already conducted the first survey, and we are collaborating on the second round of survey. So we hope we will have another chance soon to share the findings from the very important data collection efforts and study and discuss the policy implications. With that, I'd like to close today's webinar. Please join me to thank all the panelists for a very nice and very, very exciting discussion. Thank you very much.
Thank you
also,
very much.
Yeah, thank you very much. Also, before really closing, I think there's an announcement for the next webinar. So next week we will have a webinar on economy, Southeast Asia 2020. So this is 27 Friday next week. Okay. Until then, please stay safe and please stay well. Thank you very much again for joining. Thank you.
Thank you. Bye, everyone.
Thank you very much.
Thank
Bye-bye.
you and bye-bye. Bye-bye, everyone.